Welcome back to RNS Study Room. Today we are reviewing Pathophysiology Exam 3 with 100 practice questions. Read the question, pause the video, choose your answer, then listen for the rationale. Let's study smart and pass this exam. 1. A patient has sudden facial drooping, arm weakness, and slurred speech. What condition is most likely? A. Seizure. B. Stroke. C. Migraine. D. Bell's palsy. Answer B. Stroke. Rationale: sudden one-sided weakness, facial droop, and speech problems are classic stroke symptoms. 2. Which type of stroke is caused by a blocked blood vessel? A. Hemorrhagic. B. Ischemic. C. Traumatic. D. Spinal. Answer B. Ischemic. Rationale: ischemic stroke occurs when blood flow is blocked by a clot. 3. Which stroke is caused by bleeding in the brain? A. Ischemic. B. Hemorrhagic. C. Embolic. D. Thrombotic. Answer B. Hemorrhagic. Rationale: hemorrhagic stroke occurs when a blood vessel ruptures. 4. A patient with a head injury has widening pulse pressure, bradycardia, and irregular respirations. What does this suggest? A. Hypoglycemia. B. Increased intracranial pressure. C. Dehydration. D. Sepsis. Answer B. Increased intracranial pressure. Rationale: Cushing's triad signals increased ICP and is a medical emergency. 5. Which symptom is most concerning after a head injury? A. Mild headache. B. Vomiting once. C. Decreased level of consciousness. D. Bruising on arm. Answer C. Decreased level of consciousness. Rationale: a declining LOC may indicate worsening brain injury or increased ICP. 6. What is the hallmark of meningitis? A. Chest pain. B. Neck stiffness. C. Abdominal swelling. D. Joint deformity. Answer B. Neck stiffness. Rationale: meningitis causes inflammation of the meninges, leading to nuchal rigidity. 7. A patient has fever, headache, photophobia, and stiff neck. What condition is suspected? A. Meningitis. B. Parkinson's disease. C. Multiple sclerosis. D. Myasthenia gravis. Answer A. Meningitis. Rationale: fever, headache, stiff neck, and light sensitivity are classic meningitis findings. 8. Parkinson's disease is caused by decreased levels of which neurotransmitter? A. Serotonin. B. Dopamine. C. Acetylcholine. D. Epinephrine. Answer B. Dopamine. Rationale: Parkinson's is related to loss of dopamine-producing neurons. 9. Which finding is common in Parkinson's disease? A. Tremor at rest. B. Hyperactive reflexes only. C. Sudden paralysis. D. Severe diarrhea. Answer A. Tremor at rest. Rationale: resting tremor, rigidity, bradykinesia, and shuffling gait are common. 10. Multiple sclerosis involves damage to which structure? A. Myelin sheath. B. Red blood cells. C. Heart valves. D. Kidney tubules. Answer A. Myelin sheath. Rationale: MS is an autoimmune demyelinating disease of the CNS. 11. A patient with MS has vision problems, weakness, and symptoms that come and go. Why? A. Permanent clot formation. B. Demyelination disrupts nerve signals. C. Low hemoglobin. D. Excess insulin. Answer B. Demyelination disrupts nerve signals. Rationale: loss of myelin slows or blocks nerve conduction. 12. Myasthenia gravis affects which area? A. Neuromuscular junction. B. Kidney glomerulus. C. Liver cells. D. Bone marrow. Answer: A. Neuromuscular junction. Rationale: myasthenia gravis causes weakness due to impaired acetylcholine receptor function. 13. Which symptom is typical of myasthenia gravis? A. Worsening muscle weakness with activity. B. Sudden chest trauma. C. Excessive urination. D. Severe hypertension only? Answer: A. Worsening muscle weakness with activity. Rationale: weakness worsens with use and improves with rest. 14. A seizure is best described as A. Infection of the meninges. B. Abnormal electrical activity in the brain. C. Blood clot in the lung. D. Loss of kidney function. Answer: B. Abnormal electrical activity in the brain. Rationale: seizures occur from abnormal neuronal firing. 15. During a seizure, the nurse should first A. Put something in the patient's mouth. B. Restrain the patient. C. Protect the patient from injury. D. Give oral fluids. Answer: C. Protect the patient from injury. Rationale: safety is priority. Never restrain or place objects in the mouth. Anemia means the patient has A. Too many white blood cells. B. Low red blood cells or hemoglobin. C. High platelets. D. Increased plasma volume only. Answer: B. Low red blood cells or hemoglobin. Rationale: anemia reduces oxygen carrying capacity. Which symptom is common with anemia? A. Fatigue. B. Bradycardia only. C. Weight gain. D. Hyperactivity. Answer: A. Fatigue. Rationale: low oxygen delivery causes fatigue, weakness, pallor, and shortness of breath. Iron deficiency anemia is usually associated with A. Microcytic, hypochromic RBCs. B. Large immature RBCs. C. Excess platelets only. D. High oxygen levels. Answer: A. Microcytic, hypochromic RBCs. Rationale: iron deficiency causes small, pale red blood cells. Vitamin B12 deficiency anemia may cause A. Neurological symptoms. B. Increased clotting. C. Hypertension only. D. Kidney stones. Answer: A. Neurological symptoms. Rationale: B12 deficiency can cause numbness, tingling, and balance problems. Sickle cell disease causes RBCs to A. Become rigid and crescent-shaped. B. Become larger than normal. C. Multiply rapidly. D. Destroy platelets. Answer: A. Become rigid and crescent-shaped. Rationale: sickled RBCs block blood flow and cause pain crises. A sickle cell crisis is mainly caused by A. Vaso-occlusion. B. Excess calcium. C. Low stomach acid. D. Liver failure. Answer: A. Vaso-occlusion. Rationale: sickled cells block vessels, causing ischemia and pain. Which intervention helps prevent sickle cell crisis? A. Dehydration. B. Oxygen and hydration. C. Cold exposure. D. High altitude. Answer: B. Oxygen and hydration. Rationale: hydration and oxygen reduce sickling risk. Leukemia is cancer of the A. Bone marrow and blood-forming tissues. B. Lung tissue. C. Kidney tubules. D. Intestinal lining. Answer: A. Bone marrow and blood-forming tissues. Rationale: leukemia causes abnormal white blood cell production. A patient with leukemia is at high risk for infection because A. WBCs are immature and ineffective. B. RBCs are too strong. C. Platelets are too large. D. Calcium is low. Answer: A. WBCs are immature and ineffective. Rationale: leukemia produces abnormal WBCs that cannot fight infection well. Thrombocytopenia means A. Low platelets. B. High RBCs. C. High WBCs. D. Low sodium. Answer: A. Low platelets. Rationale: platelets help clot blood. Low platelets increase bleeding risk. Which finding suggests thrombocytopenia? A. Petechiae. B. Wheezing. C. Polyuria. D. Jaundice only. Answer: A. Petechiae. Rationale: tiny red-purple spots can occur from low platelets. Hemophilia is a disorder of A. Clotting factors. B. Red blood cell shape. C. Kidney filtration. D. Insulin production. Answer: A. Clotting factors. Rationale: hemophilia causes prolonged bleeding due to missing clotting factors. Deep vein thrombosis is most concerning because it can lead to A. Pulmonary embolism. B. Pneumonia. C. Gallstones. D. Migraine. Answer: A. Pulmonary embolism. Rationale: a clot can break off and travel to the lungs. Which symptom is concerning for pulmonary embolism? A. Sudden shortness of breath. B. Chronic dry skin. C. Blurred vision only. D. Increased appetite. Answer: A. Sudden shortness of breath. Rationale: PE commonly causes sudden dyspnea, chest pain, and tachycardia. Disseminated intravascular coagulation causes A. Widespread clotting and bleeding. B. Only high blood sugar. C. Bone loss. D. Enlarged thyroid. Answer: A. Widespread clotting and bleeding. Rationale: DIC uses up clotting factors causing both clots and bleeding. 31. Inflammation begins with A. Vasodilation and increased capillary permeability. B. Bone marrow failure. C. Insulin release. D. Nerve demyelination. Answer: A. Vasodilation and increased capillary permeability. Rationale: this allows immune cells and fluid to reach injured tissue. 32. The 5 classic signs of inflammation include redness, heat, swelling, pain, and A. Loss of function. B. Hunger. C. Bradycardia. D. Hair loss. Answer: A. Loss of function. Rationale: inflammation can impair normal tissue function. 33. Which WBC is first to arrive during acute bacterial infection? A. Neutrophil. B. Eosinophil. C. Basophil. D. Monocyte. Answer: A. Neutrophil. Rationale: neutrophils are first responders in acute bacterial infection. 34. Which cells are commonly elevated in allergic reactions and parasites? A. Eosinophils. B. Platelets. C. RBCs. D. Neurons. Answer: A. Eosinophils. Rationale: eosinophils respond to allergies and parasitic infections. 35. Fever occurs because pyrogens affect the A. Hypothalamus. B. Pancreas. C. Liver. D. Bladder. Answer: A. Hypothalamus. Rationale: the hypothalamus regulates body temperature. 36. Sepsis is best described as A. Life-threatening organ dysfunction from infection. B. Localized rash only. C. Mild fever only. D. Low calcium level. Answer: A. Life-threatening organ dysfunction from infection. Rationale: sepsis is a systemic inflammatory response that can cause organ failure. 37. Which finding may indicate sepsis? A. Fever, tachycardia, confusion, hypotension. B. Mild itching only. C. Slow pulse and normal. D. Increased appetite. Answer: A. Fever, tachycardia, confusion, hypotension. Rationale: these suggest systemic infection and poor perfusion. 38. Septic shock includes A. Severe hypotension despite fluid resuscitation. B. Mild sore throat. C. Stable blood pressure. D. Local redness only. Answer: A. Severe hypotension despite fluid resuscitation. Rationale: septic shock is severe sepsis with persistent hypotension. 39. An autoimmune disorder occurs when A. The body attacks its own tissues. B. The body cannot make urine. C. The heart stops producing blood. D. The lungs collapse. Answer: A. The body attacks its own tissues. Rationale: autoimmunity is immune attack against self-antigens. 40. Lupus is considered A. Systemic autoimmune disease. B. Local skin infection only. C. Blood clotting disorder only. D. Bone fracture disease. Answer: A. Systemic autoimmune disease. Rationale: lupus can affect skin, joints, kidneys, blood, and other organs. 41. Which symptom is commonly associated with lupus? A. Butterfly rash. B. Barrel chest. C. Clubfoot. D. Enlarged prostate. Answer: A. Butterfly rash. Rationale: a malar butterfly rash across the cheeks is a classic lupus sign. 42. HIV primarily attacks A. CD4 T helper cells. B. Platelets. C. Red blood cells. D. Bone cells. Answer: A. CD4 T helper cells. Rationale: HIV weakens immune function by destroying CD4 cells. 43. AIDS is diagnosed when CD4 count falls below A. 200 cells MM3, B. 500 cells MM3C, 800 cells MM3D, 1000 cells MM3. Answer: A. 200 cells MM3. Rationale: CD4 below 200 or opportunistic infection indicates AIDS. 44. An opportunistic infection occurs when A. A weakened immune system allows infection. B. A healthy person eats too much salt. C. A bone breaks. D. Blood sugar rises after meals. Answer: A. A weakened immune system allows infection. Rationale: opportunistic infections occur when immune defenses are impaired. 45. Anaphylaxis is caused by A. Severe allergic reaction. B. Slow kidney failure. C. Low thyroid hormone. D. Muscle injury. Answer: A. Severe allergic reaction. Rationale: anaphylaxis is a life-threatening hypersensitivity reaction. 46. Which symptom is most concerning in anaphylaxis? A. Airway swelling. B. Mild rash. C. Sneezing once. D. Dry skin. Answer: A. Airway swelling. Rationale: airway compromise can quickly become fatal. 47. First-line treatment for anaphylaxis is A. Epinephrine. B. Acetaminophen. C. Insulin. D. Antibiotics. Answer: A. Epinephrine. Rationale: epinephrine reverses airway swelling and severe vasodilation. 48. A type I hypersensitivity reaction is A. Immediate allergic reaction. B. Delayed TB skin response. C. Autoimmune tissue attack only. D. Blood transfusion reaction only. Answer: A. Immediate allergic reaction. Rationale: type 1 reactions are IgE-mediated and rapid. 49. A type IV hypersensitivity reaction is A. Delayed cell-mediated reaction. B. Immediate allergy. C. RBC destruction only. D. Platelet clotting only. Answer: A. Delayed cell-mediated reaction. Rationale: type IV reactions are T-cell mediated and delayed. 50. Which condition is an example of type V hypersensitivity? A. Contact dermatitis. B. Anaphylaxis. C. Asthma attack only. D. sickle cell crisis. Answer: A. Contact dermatitis. Rationale: poison ivy and contact dermatitis are delayed type before reactions. Osteoporosis causes bones to become A. weak and porous, B. overgrown with cartilage, C. infected with bacteria, D. filled with fluid. Answer: A. weak and porous. Rationale: osteoporosis decreases bone density and increases fracture risk. Which patient is at highest risk for osteoporosis? A. older postmenopausal female, B. teenage athlete, C. young adult male, D. newborn infant. Answer: A. older postmenopausal female. Rationale: estrogen decline increases bone loss after menopause. Osteoarthritis is caused by A. wear and tear of joint cartilage, B. autoimmune attack only, C. bacterial infection, D. uric acid crystals. Answer: A. wear and tear of joint cartilage. Rationale: OA is degenerative joint disease. Rheumatoid arthritis is A. autoimmune joint inflammation, B. normal aging only, C. bone infection, D. muscle tear. Answer: A. autoimmune joint inflammation. Rationale: RA is systemic autoimmune inflammation of synovial joints. Which finding is more typical of rheumatoid arthritis than osteoarthritis? A. symmetric joint involvement, B. pain after overuse only, C. no inflammation, D. one injured joint only. Answer: A. symmetric joint involvement. Rationale: RA often affects joints symmetrically. Gout is caused by buildup of A. uric acid crystals, B. calcium deposits only, C. glucose, D. iron. Answer: A. uric acid crystals. Rationale: uric acid crystals cause painful joint inflammation. The classic gout location is the A. great toe, B. shoulder blade, C. spine, D. elbow only. Answer: A. great toe. Rationale: gout often affects the first metatarsophalangeal joint. Osteomyelitis is infection of the A. bone, B. brain, C. lung, D. bladder. Answer: A. bone. Rationale: osteomyelitis is a serious bone infection. Compartment syndrome occurs when A. pressure builds inside muscle compartments, B. blood sugar drops, C. skin becomes dry, D. the stomach twists. Answer: A. pressure builds inside muscle compartments. Rationale: increased pressure reduces circulation and can cause tissue death. Which symptom is most concerning for compartment syndrome? A. severe pain unrelieved by medication, B. mild bruising, C. itching, D. hunger. Answer: A. severe pain unrelieved by medication. Rationale: pain out of proportion is a key warning sign. A fracture is A. break in bone continuity, B. inflammation of cartilage, C. muscle spasm only, D. ligament stretch only. Answer: A. break in bone continuity. Rationale: a fracture is any disruption in bone integrity. A closed fracture means A. bone is broken but skin remains intact, B. bone exits through skin, C. joint is infected, D. ligament is torn. Answer: A. bone is broken but skin remains intact. Rationale: closed fractures do not pierce the skin. A patient with long bone fracture develops sudden dyspnea and confusion. What is suspected? A. fat embolism syndrome, B. migraine, C. appendicitis, D. cystitis. Answer A. Fat embolism syndrome. Rationale: fat emboli can enter circulation after long bone fractures. Which lab is commonly elevated in muscle breakdown and rhabdomyolysis? A. Creatine kinase. B. Hemoglobin A1c. C. Sodium only. D. Bilirubin only. Answer A. Creatine kinase. Rationale: CK rises when muscle tissue breaks down. Rhabdomyolysis can lead to A. Acute kidney injury. B. Asthma. C. Cataracts. D. GERD. Answer A. Acute kidney injury. Rationale: myoglobin from muscle breakdown can damage kidneys. 66. The skin's main function is A. Protection. B. Insulin secretion. C. Blood filtration. D. Bile production. Answer A. Protection. Rationale: skin protects against infection, injury, fluid loss, and temperature changes. 67. A stage 1 pressure injury presents as A. Non-blanchable redness. B. Full thickness tissue loss. C. Exposed bone. D. Black Escher only. Answer A. Non-blanchable redness. Rationale: stage 1 pressure injury has intact skin with non-blanchable erythema. 68. A stage 2 pressure injury involves A. Partial thickness skin loss. B. Exposed muscle. C. Exposed bone. D. No skin changes. Answer A. Partial thickness skin loss. Rationale: stage 2 affects epidermis and/or dermis. 69. A stage 4 pressure injury includes A. Exposed bone, tendon, or muscle. B. Red intact skin only. C. Blister only. D. Bruise only. Answer A. Exposed bone, tendon, or muscle. Rationale: stage 4 is full thickness tissue loss with deep structure exposure. 70. Cellulitis is infection of the A. Skin and subcutaneous tissue. B. Bone marrow. C. Brain tissue. D. Heart valves. Answer A. Skin and subcutaneous tissue. Rationale: cellulitis causes redness, warmth, swelling, and pain. 71. Which finding suggests cellulitis? A. Red, warm, swollen skin. B. Cold, pale skin only. C. Hair loss only. D. Joint clicking. Answer A. Red, warm, swollen skin. Rationale: these are classic signs of skin infection. 72. Burns cause fluid shift because of A. Increased capillary permeability. B. Increased bone density. C. Low uric acid. D. Low oxygen demand. Answer A. Increased capillary permeability. Rationale: burns allow fluid to leak from vessels into tissues. 73. The priority concern in major burns is A. Airway. B. Appetite. C. Hair growth. D. Vision screening. Answer A. Airway. Rationale: airway injury and swelling can be life-threatening. 74. A full thickness burn affects A. Epidermis and dermis, possibly deeper tissues. B. Epidermis only. C. Hair only. D. Nail only. Answer A. Epidermis and dermis, possibly deeper tissues. Rationale: full thickness burns destroy all skin layers. 75. Which burn finding is most concerning for inhalation injury? A. Singed nasal hairs and hoarseness. B. Burn on finger. C. Mild redness on arm. D. Itchy skin. Answer A. Singed nasal hairs and hoarseness. Rationale: these suggest airway exposure to heat or smoke. 76. Cancer occurs when cells A. Grow uncontrollably. B. Stop dividing forever. C. Become normal. D. Produce insulin only. Answer A. Grow uncontrollably. Rationale: cancer is uncontrolled abnormal cell growth. 77. Metastasis means cancer has A. Spread to distant sites, B. Shrunk completely, C. Stayed local, D. Become benign. Answer: A. Spread to distant sites. Rationale: metastasis is cancer spread beyond the original location. 78. Benign tumors are usually A. Localized and slow-growing, B. Always metastatic, C. Always fatal, D. Blood cancers only. Answer: A. Localized and slow-growing. Rationale: benign tumors do not invade or metastasize like malignant tumors. 79. Malignant tumors are dangerous because they A. Invade and spread, B. Never grow, C. Are always painless, D. Are always encapsulated. Answer: A. Invade and spread. Rationale: malignant tumors can destroy tissue and metastasize. 80. Cachexia in cancer refers to A. Severe weight loss and muscle wasting, B. High bone density, C. Increased appetite, D. Improved immunity. Answer: A. Severe weight loss and muscle wasting. Rationale: cancer cachexia causes wasting due to inflammation and metabolic changes. 81. The purpose of chemotherapy is to A. Kill rapidly dividing cells, B. Only increase appetite, C. Replace oxygen, D. Repair bone fractures. Answer: A. Kill rapidly dividing cells. Rationale: chemotherapy targets fast-growing cells, including cancer cells. 82. A common side effect of chemotherapy is A. Bone marrow suppression, B. Increased RBC production only, C. Stronger immunity, D. Higher platelet count. Answer: A. Bone marrow suppression. Rationale: chemotherapy can lower WBCs, RBCs, and platelets. 83. Neutropenia places the patient at high risk for A. Infection, B. Hypertension only, C. Bone fracture, D. Stroke only. Answer: A. Infection. Rationale: low neutrophils weaken defense against infection. 84. Which instruction is best for a neutropenic patient? A. Avoid sick contacts, B. Eat raw seafood, C. Skip hand washing, D. Share personal items. Answer: A. Avoid sick contacts. Rationale: infection prevention is essential with neutropenia. 85. Thrombocytopenia in cancer patients increases risk for A. Bleeding, B. Hyperglycemia, C. Fluid overload only, D. Seizures only. Answer: A. Bleeding. Rationale: low platelets reduce clotting ability. 86. Glaucoma is caused by A. Increased intraocular pressure, B. Low blood sugar, C. Ear infection, D. Retinal detachment only. Answer: A. Increased intraocular pressure. Rationale: glaucoma damages the optic nerve due to increased eye pressure. 87. Untreated glaucoma can lead to A. Blindness, B. Kidney failure, C. Asthma, D. Anemia. Answer: A. Blindness. Rationale: progressive optic nerve damage can cause permanent vision loss. 88. Cataracts cause A. Clouding of the lens, B. Increased CSF pressure, C. Ear ringing, D. Skin ulcers. Answer: A. Clouding of the lens. Rationale: cataracts make the lens cloudy, causing blurred vision. 89. Retinal detachment may present with A. Flashes of light and curtain over vision, B. Ear pain, C. Joint swelling, D. Chest tightness. Answer: A. flashes of light and curtain over vision. Rationale: retinal detachment is an emergency that threatens vision. 90. Macular degeneration mainly affects A. Central vision, B. Hearing, C. Smell, D. Balance only. Answer: A. Central vision. Rationale: the macula is responsible for central vision. 91. Otitis media is infection of the A. Middle ear, B. Inner eye, C. Sinus only, D. Brainstem. Answer: A. Middle ear. Rationale: otitis media is a middle ear infection. 92. Meniere's disease is associated with A. Vertigo, tinnitus, and hearing loss, B. Chest pain and cough, C. Joint pain only, D. Seizures only. Answer: A. Vertigo, tinnitus, and hearing loss. Rationale: Meniere's affects inner ear fluid balance. 93. Tinnitus means A. Ringing in the ears, B. Loss of taste, C. Blurry vision, D. Muscle weakness. Answer: A. Ringing in the ears. Rationale: tinnitus is perception of ringing or noise without an external source. 94. Sensorineural hearing loss involves damage to the A. Inner ear or auditory nerve, B. Outer skin, C. Middle finger, D. Optic nerve only. Answer: A. Inner ear or auditory nerve. Rationale: sensorineural loss comes from nerve or cochlear damage. 95. Conductive hearing loss occurs when A. Sound cannot travel through outer or middle ear, B. Brain cannot produce CSF, eye pressure rises, D. Platelets drop. Answer: A. Sound cannot travel through outer or middle ear. Rationale: conductive loss blocks sound transmission. A patient with fever, stiff neck, and confusion needs priority evaluation for A. Meningitis, B. Osteoarthritis, C. Cataracts, D. Gout. Answer: A. Meningitis. Rationale: meningitis can progress quickly and requires urgent treatment. A cancer patient has temperature 101.5 degrees Fahrenheit and very low neutrophils. What is priority? A. Report possible infection immediately. B. Give raw fruits. C. Encourage visitors. D. Delay care. Answer: A. Report possible infection immediately. Rationale: fever with neutropenia is an emergency. A patient with a cast reports severe pain, numbness, and pale fingers. What is suspected? A. Compartment syndrome, B. Migraine, C. Cataracts, D. GERD. Answer: A. Compartment syndrome. Rationale: pain, pallor, paresthesia, and poor perfusion suggest compartment syndrome. A patient with DVT develops sudden chest pain and shortness of breath. What complication is suspected? A. Pulmonary embolism, B. Anemia, C. Gout, D. Cellulitis. Answer: A. Pulmonary embolism. Rationale: DVT can embolize to the lungs. Which patient should the nurse assess first? A. Patient with sudden slurred speech and arm weakness, B. Patient with chronic arthritis pain, C. Patient with mild cataracts, D. Patient with stable osteoporosis. Answer: A. Patient with sudden slurred speech and arm weakness. Rationale: these are signs of stroke. Time-sensitive treatment is critical. That's your 100-question Patho 3 review for RNS Study Room. Keep practicing the cues: sudden changes, airway, bleeding, infection, neurosymptoms, and perfusion. Those are the signs Rasmussen loves to test. Keep studying, keep pushing, and I'll see you in the next RNS Study Room lesson.